Hello, I'm Dr. Randall Secretes, your host for eOrthopod TV. And today we're in Kirkland, Washington, and we'll be talking with AnnHays. Ms. Hayes is a patient who's recently undergone a total knee replacement as an outpatient. And we're going to talk with her today about how that procedure went, sort of what her fears were before the procedure, and looking back, would she do it again? So thanks for joining us today.
You're welcome.
So Ms. Hayes, I guess tell us what you do.
I am a nurse. I work in the recovery room, so I'm on my feet a lot. I work 10-hour shifts, and I do a lot of work with orthopedic doctors, short stay surgery.
And what led up to your decision to have a total knee replacement? When did you first know that you were headed towards having an artificial knee?
I had a knee arthroscopy about a year and a half prior, and it helped a little bit. And then the pain just became worse and worse, and I was just struggling, so we took some x-rays at the clinic that I work at with the doctor who did the knee arthroscopy, and he just said it's bone on bone.
And had you had a previous injury to this knee as a child or a teenager or a young adult?
I did a lot of snow skiing, and I always say that was my downhill racing ski or leg, and so I think that was it, just a lot of trauma, doing moguls and that type of thing.
So pretty much wear and tear.
Yeah.
No ligament injury or meniscal tear, anything that you're aware of in your past or anything. What led you to the decision to have an artificial knee replacement? I mean, what symptoms were you experiencing that you said, I can't live with these anymore?
I wasn't able to continue walking my dogs. I couldn't keep up with my girlfriends when we would go on excursions, and the pain was excruciating.
And what about nighttime? Were you having difficulty sleeping when you were active?
Yes.
So it was affecting sleep.
It was affecting sleep, and I went to bed every night with ice packs on my knee, and not looking forward to getting up in the morning because it was going to be a painful day. And with my job, I could not be taking any kind of narcotics.
And how long has it been since you had your artificial knee at this point?
Let's see, it was January 14th, and we are May 16th, so 3.5 months.
Okay. And you had done some research, I understand, before the surgery to try to determine what was the right approach for you. And I understand you chose to have an artificial knee done by a surgeon that is trying to move towards doing artificial knee replacements as an outpatient. Come in the morning, go home in the afternoon. And my understanding is that's what you experienced.
Correct. So working with a lot of orthopedic doctors and doing a lot of recovery, we did a lot of knee manipulations because the trauma that people experienced with their total knee replacement and the pain that they experienced preventing them to do the typical exercises that you want. And I knew then that I didn't want to face that. There was an article actually in one of the OR magazines on the total knee, doing it the way Dr. McAllister does. So I even think he might have been mentioned, but I read that article, then I started doing research as to who in our area performed this type of procedure.
And a couple things about that type of procedure. I think that one of the things that makes this different is using the minimally invasive techniques and using the computer-assisted navigation, which allows you to do the minimally invasive sort of types of incisions. But primarily, this notion of doing it as an outpatient, was that concerning to you at all, that you would not be in the hospital the day after your surgery where you could get good pain control or have people watching after you? Was that at all anxiety provoking for you?
A little bit. I was nervous, because I'd only seen people miserable, suffering with a lot of pain. And when Dr. McAllister suggested outpatient, I thought, I'm not sure, But he was convincing enough. I felt healthy enough, and I knew I had a lot of support. He also reinforced that if for any reason I felt uncomfortable going home, I could spend the night. The only requirement was that I meet up with physical therapy prior to the surgery, so I knew how to get up and down stairs and that type of thing.
And in terms of support at home, what type of support did you have at home?
Let's see, I lost my husband, so I didn't have a spouse at home. So I had my daughters, and it was first week, you need someone there to help you get out of bed and just be sure that you're stable. Cooking meals and just helping you get up and about, doing regular routine daily habits.
And did you have round-the-clock coverage? I mean, were your daughters there with you 24 hours a day for that first week?
Right. One of them was at least with me at night. And they kind of switched off, so they had meals. But I definitely think for the first, actually I think about the first 5 days, it was comforting knowing, that someone was there to help me get out of bed. And then I just felt good enough that I just started doing it on my own.
And pain. Pain is one of the things that people, I think, fear the most about after surgery and any sort of major surgery. And clearly, an artificial knee replacement is still very, very large surgery. Was that a concern of yours? Were you concerned about your pain control before surgery?
Yes, I was. I was nervous about that.
Do you think that being a nurse made you more anxious or less anxious about pain control?
Probably a little more anxious because I was seeing what people had gone through. Had several friends whose mother or father had gone through it the traditional way and how miserable they were. So I was like, oh. But I was so miserable with the pain that I was currently experiencing that I was ready to take the risk.
So looking back, was it worry all for naught, or was the pain as bad as you thought it was going to be?
It was not very bad at all. Actually, it was much less painful than what I had experienced prior.
So you actually had less pain.
I did.
After surgery.
Yeah. They sent me home with, all the pain medication I would need. And basically, I stuck with the Tylenol, the anti-inflammatories, and I really just used the oxycodone at night before I went to bed.
And for how many days after surgery do you think you required a narcotic pain medication?
Initially, not very much at all. It actually I needed it a touch more when I started going through physical therapy, just the use of the knee. But it was like one pill. It wasn't like, I was down for the count.
And in terms of your ability to get around and how you were getting around at home, when you went home, were you using a walker, crutches, or were you able to walk on the knee right away?
I used a walker. My daughters and close friends were amazed. I was able to walk up my stairs the night that I got home without any problem at all. So I just used a walker for a couple of days. And actually, I bounced right back. I was, they were all nervous, but, I was able to get around easily. I used a cane, and that was just enough. That's all I needed was the cane.
And when did you actually start driving a car, and perhaps when did you go back to work?
I went back to work in 6 weeks. I know that Dr. McAllister was saying, ask for 8, so if you come back early, they feel better about it, but he wasn't too sure, being that I'm on my feet all the time. And but I was ready to go back in 6 weeks and did fine.
And were you pretty independent at that point?
Oh, yes.
So
yeah.
you were driving?
I was driving. Luckily, the surgery was on my left knee, so I had my right knee for driving. And I was driving within a week.
Now, being it's 4 to 5 months after surgery at this point, do you feel like that you're essentially to the point to where you don't even consider having an artificial knee at this point, that it just feels like your regular normal knee?
Yes, it does. In fact, I just went to the dentist, and you're supposed to notify the dentist for an antibiotic and stuff. I never thought about it because I never think about my knee, because I'm out there pulling weeds and on my knees, and so when I got to the dentist, I thought, oh my God, I should have told you, because I just don't ever think about it. So,
Any advice for patients that are struggling with this decision going forward? Anything that you would recommend?
you know, I did my research. It was minimally invasive. In comparison to what I see as a professional in the medical profession, it's the only way to go, I think, because it's there's not very much pain involved. You have a tiny little scar, and you're up and going in a couple of weeks.
Well, I think it's been great advice for patients, so I want to thank you for sharing this with other patients today.
Thank you.